This is New York Nightly News with Chuck Scarborough, live on New York Nonstop.
The air you breathe might be a worse trigger for heart attacks than hard drugs, a bad diet, or an irritable disposition. A study in the British journal Lancet bases that finding on examining not just the factors themselves, but how prevalent they are. For instance, cocaine users aren't using drugs every second of the day, but that's how often big city dwellers can be exposed to foul air every second of the day. Incidentally, researchers did not examine the role of secondhand smoke, but they say it likely falls under the air pollution factor. Heart disease is the #1 killer of Americans. And joining us now with tips on how to protect yourself against this killer is Dr. Aubrey Galloway, chairman of the Department of Cardiothoracic Surgery at NYU Langone Medical Center. Doctor, welcome aboard.
Thank you, sir.
Why is it the #1 killer?
It's the #1 killer in this country, interestingly, on women and men. And it has to do with many things that we can prevent, such as diet, cholesterol intake, lack of exercise, smoking. You mentioned air, and that's coming into play maybe. But there's a lot of things that relate to heart disease that we do to ourselves that could potentially be changed to prevent this, but yet it continues on as the #1 killer.
Is this something unique to the American diet and experience, or is this a global phenomenon?
I think it's unique to the Western civilization experience. It's prevalent also in some forms of Western Europe, but certainly in the United States. And then there are other parts of the world where they have less fat in their diet and they're less overweight, and the incidence of heart disease is dramatically less.
So what's a heart-healthy lifestyle?
The best things for health for your heart would be standard good exercise, not over-the-top exercise, but standard exercise, balanced diet with good nutrition. You need to understand your cholesterol numbers and understand LDL cholesterol. It should be low, and good cholesterol, you should know that. And good blood pressure, and not being overweight. Every American should try to understand what their ideal weight should be. Abdominal obesity is a risk factor for heart attacks, so if you're big around the abdomen, it's a bad risk factor, and you need to correct that. And I think the more people understand it, the more we can take steps to prevent it.
It's actually been said that belly fat is a marker of heart disease. Is that correct?
Absolutely.
It actually indicates you might have heart disease?
An independent marker, secondary, separate from all the other things we talked about.
At what age should we really start thinking about the heart-healthy lifestyle?
I think the answer is in grammar school and grade school, and that's why these new initiatives for preventing obesity and childhood obesity, because it gets started very early, and sometimes the process is well underway by the time the people are in their 20s or 30s. So beginning there, but certainly as people begin their adult life, they should adopt patterns of lifestyle and behavior that will help prevent this as the years go on.
All right, Dr. Galloway, thanks for coming in and sharing your wisdom.
Thank you.
Appreciate it.